VOOV meeting on this Friday evening. And of course, today I'm your facilitator. My name is Andrew Ling. For those who do not know me, I'm the GM of the Ventros. And of course, today we have a very special speaker that is with us. Okay, but basically what we are going to talk about today is actually, it's called the Discover the Uniqueness of AgX. Now, a lot of you might thought that this AgX is actually a disinfectant or just a sanitizer or something like that. But in actual fact, this AgX is actually more than that. It's more than that. That is why today we are really have the honor to have our speaker, who is Mr. Albert Chai. He is actually the technical consultant to AgX, to Ventros AgX. Now, it is really an honor for us to have him here to share with us regarding the AgX. He is actually quite experienced in these products, and he got a lot of knowledge to share with you. And of course, tonight, the good news is after the presentation, Mr. Albert Chai is going to ask all of you a few questions. And tonight, a few bottles of AgX will be given out. Okay, so for the next coming 45 minutes, please concentrate. Mr. Albert will be asking a few questions after the presentation to see whether you all know the answers or not. Okay, so pay attention for the next 45 minutes. Okay, ladies and gentlemen, let's not wasting any more time. I will pass the whole thing to Mr. Albert Chai. Yeah. Mr. Albert, are you there?
Yes.
Yes. So are you ready?
Yeah.
I'll pass the whole thing to you. Thank you.
All right. Thank you very much. Let me see. Okay. Yeah. Can you see the first slide here? All right. Good evening and welcome to all of you. Thank you for joining tonight's meeting presentation. I want to thank the management for giving me this opportunity to share something on this on the uniqueness of the Ventros AgX Nano Silver solution. Well, my name is Albert Chai, and I'm a consultant to this involved in this Nano Silver for many years. Yeah. So the purpose of the meeting for tonight is to help members understand more about AgX Nano Silver. So first of all, it is not intended to offend or insult anyone. So in meeting there may be a slip of tongue. In case there's a slip of tongue, please forgive me and bear with me. Okay, this meeting, I hope that there will be no interruption. So if you have any question to ask, okay, you may write it down and we can deal with this in the Q&A session. During this presentation, we also have, what I call it, we have question break time. In the question break time, we have a 15 seconds window when if you are able to answer the question that I asked with the permission of the company, you will get a bottle of AgX free. All right. So we will start with the presentation. Okay. If you look at this picture here, first thing I will start with the testimony. This person have a diabetic leg for many years, and in the end, the leg became too serious. You look at it, it's gangrene-like. Which means to say the blood flow is so horrible, so terrible that the leg is supposed to be amputated. So his doctor recommended to him that the best for him is to amputate both his legs. You know that if we have our leg amputated, even if we do that, the rest of his life will be sitting on a wheelchair. And that is not the good news. And if we amputate it, the gangrene will continue and it will cut upper and upper, higher and higher. In the end, he will still have to die. So I get to know this person through the Diamond Director, Cindy Low. So she shared to me about this case and asked me any solution I can have. So I recommended him, and she sold him iron laser only. But there are definitely improvement, but it won't be overnight. You can't see that overnight. So I recommend him to take use this silver, nano silver, this AgX. So to spray on the wounds. First thing is to spray on the wounds because it is eating up those cells here. And then number 2 is to drink 30 ml a day. That is to orally to drink 30 ml a day. 10 ml in the morning with warm water, 10 ml in the afternoon with warm water, and 10 ml in the evening with warm water. So for all the way, so he was quite obedient, and he's willing to try because I believe he's quite desperate on his situation, and he's using the iron laser consistently, and then also this nano silver consistently. So after if you look at this lady, she started with only a very minor problem, and itch on the hand. You know, her hand was there's some minor growth, like those what they call it, ringworms. You know, so it was a bit itchy, and then she started scratching it. But while scratching it, no, she went to the pharmacy to buy those antibacterial cream. So she applied upon it. After a short while, the ringworm was gone, the itch was gone, but then it subsided for a time. But not too long, soon after that, the ringworm come again. Then the itch getting worse and worse, you know. So she went to the pharmacy, buy back again the antifungal film, the cream. So this has been on and off, on and off, on and off for quite some time. But each time the itch was gone, when it come back, the itch is getting worse and worse. In the end, after a few years, 2 years time, you know, she was so serious that antibacterial cream that is normal that you buy in the pharmacy couldn't help anymore. Then she went to look for a skin specialist, and with her condition so bad, not like in the picture here, not yet anything that serious yet, but it's already serious. She went to meet the skin specialist. So the skin specialist, knowing her condition, can only administer to her steroid pills, steroid medicine. So as she take it, the same thing. For the first week, things go very well, and then they stop. In a short while again, after 1 week or 10 days, the thing come back again. So, and then the leg become to the edema, you know, it's swollen a little bit, and then getting worse and worse. So in the short span of another 1+ year, so all this about 3 years, his skin, her skin begin to excrete out those liquid from the head to the toe. You know, it is so smelly and so itchy, and it really caused her a lot of discomfort. Yeah. So when I went to her her house, you know, and look at it, it is a little difficult to even breathe. The room, the smell is quite full. You know, so at that time I have a bottle of nano silver. So I asked her if permission I can spray. The moment I spray, she on her leg, she found that the itch is lower. It was itchy, but then after spraying it, you know, in a very few seconds only, you know, she found that the itch was lowered down, very little itch. So she began to accept a little bit. So allow me to spray on the environment, on the living room. The whole room have no more smell. So after that, I asked her if she is willing to trust this product. So I asked her to spray on the whole body, from the head all the way to the toe. You know, so she sprayed. Not in front of me, she went back, she went and sprayed. But and then later, I also asked her to drink it orally, like the same, like the one that is have the diabetic leg. I asked her to drink 10 ml in the morning with warm water, 10 ml in the afternoon with warm water, and also 10 ml in the evening with warm water. So over a period of time, she continued taking it. But the first thing she realized was the itch is gone. After spraying just the one day, the same day she sprayed on her body, there's no more itch at all. No more itch. And then no more smell. Is it that amazing? And then she kept doing it and kept drinking because she began to have some faith already. After 40 days, then she gave me back a photo and then we went to visit her. See, this is 40 days. Have you seen the difference? From the leg, swollen leg, you know, the edema was gone. So it is a very amazing product. The AgX is more than what we think, just as a sterilizer, like Andrew said. It's more than that. So now I'm introducing to you this uniqueness of this product. Okay. All right. Nano silver. The first thing is that it is made with 99.99% pure silver. We cannot mix with any other ingredient. It is pure silver alone. And the ingredients of AgX are very simple. Clean water, 20 ppm of nano silver. That's it. So it's nothing, no other ingredient, only two. Water and nano silver, 20 ppm. In the ancient days, silver has been used by the in ancient for many years. According to some internet, it says it started sometime around 4000 BC and then 3000 BC. So I went to check in the Chinese history. You know, only in the around 2500 BC, that is 4005 years back, there are records that they are using that as for medicine, and but mainly for battle wounds, you know, during wars. We also find that there are records being used by the Persian, the Greeks, the Roman army. You know, they use that as a medicine also, including battle wounds. So there's no surprise that silver has been used for few thousand years already. So many are worried whether silver is safe to use or not, but the record has been a few thousand years and it is very natural. The ancient, if you go to those, we heard of those royal palaces, all those king and queens, they have all the silverwares, silver spoon, silver forks, silver cup, silver plates, anything you name it, all silver, you know. So they use that to prevent food poisoning, and also whenever any food touches silver, the germs itself die. Yeah. Yeah, you see the picture here. I give you an illustration. That is how in the war they use silver extensively. And then here is a picture of all these silverwares. You can see spoon and forks, but that is more than that. You know, in royal family, it's very common that they use silverware. So you can see the silver jar here. On my left side, there's a silver jar. In the ancient days, they used to put in the water and also milk as a preservation, that it will stay fresh in a period of time. It is widely used by the older generation from China. On the right side, you saw that I put in 2 silver coins. Now, I don't know how many of you have a grandmother or grandfather have used silver coin before. For myself, I remember my mother used that whenever I have diarrhea or stomach discomfort. So what she did, she will boil the eggs. After boiling the eggs, you will put the silver coin on top of the eggs, wrap with a handkerchief, and then begin to stroke my stomach. Keep stroking a very short while. The pain is gone. But if for a longer period, she will take the coin and put it into a jar and boil it with water. So after boiling it and then make it cool, I drink the water. Just simple. You know, so silver coins are very good. But not the coins that we have today. You know, Chinese call coins, we call it ganjai, you know that. Those are not silver. Most of the coins today are nickel made. They're made of nickel. Or some not even nickel, you know. It's cast iron, tinted with nickel. You know, so it's very deceiving. Like our $1 coin today, can change color into, can even go rusty. But a silver coin can last for years. I have quite a number of coins with me. There are some coins worth 30,000 now. I'm not selling it. I'm keeping a lot of old coins. Some are silver coins, and they're really good for if you in any emergency of diarrhea, you put it to boil it with water and drink it, and it's really helpful. So prior to 1938, we call it silver solution is electrocolloidal silver. It was administered orally, rectally, vaginally, and intravenously into the nose, the lungs, and the eyes. Now, as a topical form of throat gargles, eye drops, and douches for the treatment of open wounds and burns. This part I will read the whole thing for you because it's important. They use it. How they use the method, is mainly for wounds and bacterial infection. It was widely used for protection against blindness because some of the parents or the mother may have contracted venereal disease, either from the husband or all these diseases children. So in 1978, you look at the sign that yes, I have the copy with me. The silver is our mightiest germ fighter. So in the 1940s, silver began to die down. But as the years goes by today, more and more doctors and people are believing that silver is better than antibiotics. So in the ancient use of silver, it is for wounds, to test poison, prevent microbial infection as a preservative, and for skin itchiness and chicken pox, stomach discomfort, diarrhea. So conclusion is that in silverware, silver was the most important antimicrobial agent available before the introduction of antibiotics. Yeah. Now, so I have a question breakdown. Okay, if any of you can answer the question within the 15 seconds window, you will win one bottle of AgX. Okay, number one. What are the ingredients of AgX? Can any one of you answer? Sorry,
Cynthia?
Anyone can answer
Cynthia first. Cynthia, put out the hand first.
Okay, I can see that.
Cynthia?
Can you unmute your unmute it?
Cynthia, are you there?
Okay, yeah. Silver. Ingredient is silver.
What are the ingredients of AgX? Silver and what? And Milo?
Silver and water.
Okay. Andrew, help me to mark them so that the AgX give it to them. Thank you very much.
Cynthia.
Yeah. The second question. How many ppm is a AgX solution? Okay, you have 30 seconds.
Too fast. Wait. How do I? Because everybody is throwing in the answer. The first one.
The first answer. Can you see anyone who have the first answer?
No, there are some people who put out the hand, but once they put out the hand, it will be there forever one. So I think the best way is for those people who type in the first answer from now lah.
Okay, better. All right.
Okay. The first one is actually Maria. A person called Maria. Silver 20 ppm water.
20 ppm silver. Silver 20 ppm.
Silver 20 ppm plus water. That is the answer that was given.
All right.
Mariam. Maria. Can you leave down the full name, Maria? And Cynthia, of course, I know. Maria, Can you leave down your full name in the chat?
All right. I have one more question to ask. Here, question 2 of 3, and then 3 of 3. One more. Give me 2 examples of the use of silver in history.
The first
2
one
examples.
to type in,
Yes.
no lifting hand, the first one to type in now. From now onwards, it's all typing in.
Yeah. What is the 2 examples of use of silver in the ancient history?
James Wong for keeping milk.
Okay. Thank you. Stomach discomfort. Okay. Okay. The 4th question is, who discovered penicillin? The last question, who discovered penicillin? Can anyone answer? I have 10 seconds to go. Okay. Alex, okay, never mind. Yeah, correct. J52 is Alexander Fleming. All right. Okay, thank you for the
Okay.
this question break time.
Sorry, let me just for those people who are getting the AgX, number 1 is actually Cynthia. Number 2 is Maria. Maria, please leave down your full name in the chat so that I can trace. Number 3 is actually James Wong. Number 4 is actually J52. J52, please leave your full name as well so that we can contact you to get the Mariam form. Okay, thank you, Mariam. Yeah.
All right. Okay, if you look here, the discovery of penicillin as a replacement of silver. So in the early days, before 1938 or before 1940, it's a very common use by doctors, medical institution. Silver is a very widely used element for treating all these germs, bacteria, related microbiome things. So by 1940, the introduction of penicillin, we call it in short, is antibiotics. So penicillin is the first antibiotics introduced in the 1940s by Alexander Fleming. Alexander Fleming discovered this penicillin in 1928, but it took years to develop, and over the years of research, then finally it came out. But last time when they sell this silver, it is called macro silver, and the price definitely is far higher. And when penicillin was first discovered and made, the price was so cheap, we call it dirt cheap at the time, that it is most medical institution would prefer to use that in replacement of silver. And because the germs are not used to a new drug, so when penicillin was first administered, it was so effective. But over the years, until today, the penicillin that was first discovered, you cannot even use it on the baby today. The germs have mutated so strong that the initial penicillin have no more effect. So because of that, of the result at that time, most of the advancement of silver research was shoved down. So no more further on this silver. It was all on antibiotics since then. So science have kept developing over the years from 1940 until today. That is 80 years. In these 80 years, it's all about antibiotics. So it's common that if you get a cold, the doctor will tell you take antibiotics. When you get a wound treatment, they will give you antibiotics pills. And that is the trend now. Very seldom would a doctor tell you use silver, nano silver. Everything is antibiotics, because the antibiotic is so profitable, and it is easier to control in this medical industry. So when we talk about this approach of antibiotics, no pharmaceutical company in the world is interested in developing silver anymore. Because why? Silver, if you have a wound of injury, it will heal you, and it's for good, natural healing. But if you take antibiotics, the germs will mutate. So over the years, the strain of these germs, bacteria are getting stronger and stronger. Even the virus today is so strong. That is why we have pandemic today. You know, this keep developing into a bigger and bigger brother, you know. No, the younger brother getting stronger and stronger. You know, this is how antibiotic works. And no pharmaceutical company will want to develop that because it's not, they have no leverage. You have never seen any company that sells high blood pressure pill, and then you take a few pills, you have no more high blood pressure. You will continue to have it. The same thing with diabetic pill. You know, nobody have taken any diabetic pill and they was recovered. You can only suppress it. So, but over the years, the milligram that you are taking from this pill, the dosage increased by the years, and in the end, yeah, you're getting worse and worse and getting worse. So it won't recover you, because what they call it, with due respect to pharmaceutical companies, they are not interested to give you anything that can cure you out, but they need leverage. They want to have a long-term profit. That's the reason why antibiotics today are so rampant, so common. You know, everybody uses antibiotics, but antibiotics have a side effect. You know, it's potentially it's toxic and potentially dangerous. You can take it. So when you go to see a doctor, the doctor still prescribe you with antibiotics, but they tell you very clearly, you must finish the dosage. Never take antibiotics halfway and then throw it down the drain. It is very fatal doing that. So whenever you take antibiotics, it's okay, but must finish the dosage once and for all. Make sure that the germs are all wiped off from the body. Don't let it stay back. Because any unfinished business inside, the germs will mutate into a far stronger strain. So you know that. I hope that in the future, when we take antibiotics, we will seriously think about that. Use it to the most, unless you use silver. So, but until today, this silver we can still market it. It's not that since they don't use it, we can't sell. They still allowed to sell, but we have to use as a pre-1938 drug under the FDA rule. So the claim and everything is under that period of time. Other than that, you can have a new, what do you call it? If you want to sell antibiotics, no problem. But silver, the claim is up to pre-1938 drug static. So in conclusion here, I say that antibiotics must complete cycle per use. And over time, the mutation of bacteria, germs, virus, and fungi will getting stronger and stronger. So today you see why the germs and these bacteria are getting so strong, and you need more powerful antibiotics because it keeps mutating. But I've been in this line for so long, about 17 years now. I've never seen this bacteria. They touch the silver, they can, even though they are very strong, they won't die. But when they touch the silver, they sure die. It is because silver is so natural. No matter how the germs have mutated, how the bacteria have mutated, or the virus or the fungi, silver touches it, they still die. You know, so silver is a very good solution for this problem. Yeah, electrocolloidal silver and its feature. First thing, many people don't realize that ECS or electrocolloidal silver is extracted from high DC voltage. In fact, it's a DC voltage. If you have a very small rod, you can also extract it out. But whether it is able to spray to your eye or not is one thing. Because when we produce this, we need a very clean facility. The water have to be very clean. Everything, environment have to be very clean. So there is no chemical use, no alcohol, no parasites, no antibiotics, and no steroids. So ECS is in nanoparticles. So I have one question for you. Can anyone describe roughly how many microns is the thickness of our hair?
Okay, the first person that throwing the answer in the chat will get the prize.
10 seconds. 5 seconds. Okay, the size of a hair is 50 to 70 microns. Then second question, can anyone roughly describe how small is 1 nanometer or nano? People always say nano silver. What is 1 nano? Can someone briefly describe it, 1 nano? Ten seconds left.
Anthony Ching, 1 upon
1 upon 1 million what? 1 upon 1 million what?
meter.
-9. 100,000 nano. That means the 1 million Anthony Chin, I'll keep your answer as correct lah. Okay, okay, I will explain to you how small is a nano. Can you see the big dot here? This represents our human hair size, 50 to 70 micron. Then on the far right, you saw a small dot, that is 1 micron. Okay, on the far right is 1 micron. And I go another one. So this whole ring, the human hair size is the 2,000 times the size. And you just a one small dot there, 1 micron. And when you take the look at the arrow, 1 micron have 1,000 nanometers. So 1 nanometer is so fine that your mind can hardly grasp the size of it. And just imagine this creation, such a minute thing, you know, it's still effective. Micron is in every what do you call it? In every micron, there is 1,000 there's 1,000 nano. In 1 meter, you have 1,000 mm. Okay, in 1 meter you have 1,000 mm, but in 1 mm you have 1,000 micron. 1,000 micron. In 1 micron you have 1 nanometer. So 1 mm, one is 1 million nanometer, not a meter. 1 nano, 1 millimeter. Sorry, 1 millimeter has 1 million nanometer. So that is a small size. That is why this is so fine that it penetrates into your gum. So if you have a toothache, you spray to your tooth, you will find that in about 1 minute time, it's better than Panadol or painkiller. I've actually gave to a lot of those missionary friends. They went to China last time. They went to China, India, Nepal. And we talk about missionary work. It's all in the rural area, very remote. And those remote area, you can hardly buy any medicine. You can hardly find doctors. So in the middle of the night when they have toothache, I tell you it's very painful. You know, those who have experienced, I think all of us have experienced a toothache before. It is very scary. It's more painful than anything. You can't sleep, you can't walk, you can't talk, you can't eat, you can't anything. The pain is always bothering you very much. So the one solution is we take painkillers, we take Panadol, and but it doesn't subside the pain. You use nano silver, AgX, you spray to your teeth on that part. My wife have quite a number of times have what call it quite shitty after taking fried foods. The teeth will be painful. So she spray AgX to the gum, and just in a minute time, settle back to normal. You can eat again without pain. So you can try by yourself. You know, it's edible. So AgX that doesn't say that you can eat it, but if you have sore throat, you can spray it, and it's very good for your sore throat. This is the agony of a toothache. Yeah. So ECS and its feature, first thing is that it is a natural solution. There's no chemical, non-toxic, non-addictive, and cause no harm to the liver. You know, this is one amazing natural ingredient that even you drink into it, your body, your kidney can discharge it out of your body. So it won't accumulate in your body, but hence it's very safe to use. Unless you drink it every day, 30 ml a day, just half bottle every day for 4 years, then you will have what you call it, no known side effect, but you have over drinking ECS, you can cause argyria. that is called royal blood. Your skin will get a little darker, it's bluish in color. So that's the only side effect. But it doesn't kill you. It doesn't cause any other failure to your organs. So in that aspect, they say there are some side effects. That is, the skin will turn a little bit darkish. So other than that, it's very safe to use. So, and then one of the key features here is antibacterial, antifungal, antiviral, and antimicrobial. So you just think about this thing. So I will ask a few questions. What causes us to have wound to smell? What causes our wound to swell when we get a cut from our fingers or hand or anywhere? What causes the wounds to swell out? It's germs, bacteria, isn't it? What causes our feet to be smelly? When some people have Hong Kong feet, we call it Hong Kong feet, athlete foot. So it's also germs and bacteria. What causes our mouth to have bad breath? What causes our eyes, our sore eyes, or conjunctivitis? And then what causes venereal disease? Now all these bacteria and germs are the thing behind it. And so whenever you think about anything related to these germs, bacteria, I will whenever you think about these germs, bacteria, virus, and fungi, you can always apply AgX, and it's very, very effective. Whether your mouth is the breath is very bad, you just spray. Better than those what do you call it, mouth spray. They have this what do you call it, peppermint mouth spray. You just use AgX. It's better. And then if you have a sore eyes, you just spray to the eyes. Now I will share my experience with you on sore eyes. I've come across a few people who got sore eyes. So if they use eye drops, or they look for any eye specialist, so they will administer to the eye drops. And using eye drops, your eyes will still be painful for 4 full days. You cannot open your eyes because it's like a knife cutting your eyelids. Your eyelids is swell. So what you do, you take AgX, you spray to your eyes. Okay, when you spray to your eyes, in about a minute time, okay, I put it to 1 minute. You will be surprised to find that you can open your eyes without pain. But you only realize that your eyelids is still, because it's swollen, it is still tight. But opening, shutting your eyes have no problem. So every 2 hours you keep spraying it. By the second day, before the third day, you will be healed. It's recovered, fully recovered. But the amazing thing is that none of those in your family are affected. It's not contagious. But if you do not use this one, on the third day, see who is unlucky. One of them will be affected, and then they will have sore eyes, and they will pass down to the third person, fourth person, fifth person. So it's contagious. But using AgX for sore eyes, it's not contagious at all. So if you ever happen this again, ever experience this conjunctivitis, use AgX. So don't worry, it won't cause you blind. So nano silver is very safe. So many of them are scared. Even if you have running nose, you can suck it into your nose, and then it goes to your lung. It will help your lung immune system and prevent germs from growing there. So especially during this pandemic, it's very good to spray to your lung. Like recently, I just have one friend who have lung problem. So we told him, you just spray to your nose, and from the nose, you go to the lung, and just by that, his breathing is getting better and better and better. So silver AgX is a very interesting product that we have. It's very effective against wound healings, cuts, ulcer, childbirth wounds, surgery wounds. Now I have 5 grandchildren. I also always advise my daughter-in-law, my daughter-in-law or my daughter, after giving birth, they have birth wounds, childbirth wounds. If they spray using AgX, the wound recovery is far faster. In less than 1 week, they can sit normally. Anywhere they can sit on a chair without pain. But if you use any other method other than AgX, they need to use those, you know, the swimming ring. There's a ring for sitting. They have to sit on it so that it wouldn't impact the hard chair. But using AgX, the wound is very fast. Yeah, then against infection of eyes, ears, sinus, the throat, the lung, and the skin. So if they have, I have many friends who have sinus problem. If you touch on the face, it's really painful. So what I can only do is that I ask them to suck, to use the nose to suck in the this AgX, and you'll be surprised. In 1 week, they can press hard to the sinus. There's no more pain. You know, the colloidal silver is so powerful. It penetrates to our sinus area, and it just kick off those germs and bacteria that is causing the pain inside the face. So it prevents growth of warts via viruses and remove foul smell and odor. Now, removing foul smell is one of the good signs of how strong ECS can be. When you can try to go back, you can go to your kitchen. If you have a dustbin, it's very smelly. You can try and use AgX and spray to your dustbin. Just give 3 spray. You close it and count 5 seconds, open it, no more smell. That's very amazing. The impact on germs, bacteria, fungi, and this virus is so fast that it just amazes you. So finally, this electrocolloidal silver, in this feature, is odorless, tasteless, it's not stinging to your wounds, harmless when you administer topically. It's very harmless. Yeah. So question break time. Number 1, name one reason why medical institution uses silver to a lesser extent. That means they don't use silver anymore. Why?
If you know the answer, please type the answer in the chat. The first person that Anthony Ching.
Yeah, pendulum too cheap. It's too cheap for penicillin. So because of its low cost of penicillin, they don't use silver anymore. Silver is so expensive to use.
So
Okay.
you, Albert, you will accept which answers? Linda, Anthony, or Linda?
I don't really know this pendulum too cheap is what is that? Very low. Yeah. Mariel is correct. Is it Mariel have answered once already?
Yes, Mariel already got one.
Sorry, Mariel. Yeah. You have answered one, so give other guys a chance. Sorry.
Linda, what about Linda? Very low or no profit? Silver.
Very low of what? I need a bit specific because like Mariel here says expensive than penicillin, and that is actually an answer. More specific. Because very low. Which one is low? Penicillin is too cheap. Correct.
And
okay,
Anthony already have one already. Anthony just now, Linda go, because Anthony has already got one just now.
Is it? Not?
Yeah, he has one.
Oh, you have already taken one. So who else?
Then Linda go profit for silver.
No, it won't. Pharmacy cover cannot make money. Yeah, that's correct. Because on silver they can't make any money. Penicillin they make very much more money than silver.
So you choose Sally or who?
Yeah, I will choose Sally because J52 already have one.
Yes, correct.
Sorry,
correct.
those who have answered and have a AgX, you can give to other people a chance to take answer.
Okay. So once again, J52 and Anthony Ching, please leave down your full name with your handphone's number, and also Sally as well, so that we can contact you and send you the AgX. Okay. please leave down your full name and contact number. Thank you.
Okay, then second question here. Why electrocolloidal silver is safe to use? Why electrocolloidal silver is safe to use? Can anyone? Natural solution without, okay, correct. Natural solution without chemical. Okay, Jesselyn? Jesselyn Lim. Okay, I think your answer is correct.
Okay.
Yeah, last question here. Can you name me 2 features of AgX nano silver solution? Features are not benefits, features. Make sure it's features. You can see that in slide 31. Probably, yeah, I think it's 31. I've mentioned that. Any answer?
Any other answers?
What is it? What name 2 features of AgX nano silver? Okay, non-toxic.
J52 already got the.
You got the answer. Well, you're very good. You can go for test. You can get 100 marks. Really attentive.
So anyone else apart from any other people who want to try? J52 is very kind. He already give all the answers. Maria also natural, non-toxic. Okay.
But Mary already answered just now, also the same.
Yes, correct. Anyone else who want to give a try? Joe
Okay,
Tan.
no side effect, safe and natural. Correct. This is one of
Okay.
the.
Joe Tan, please kindly leave your full name as well as your contact number. Thank you.
All right, thank you so much. Yeah. Okay, I show you a picture of the rash caused by chemotherapy. Okay, this person have a throat cancer, and after chemotherapy, he can't talk, he can't eat, he can't sleep, and it's so itchy that it's so irritating. You know, it's when itchiness comes to your body, or especially your wounds, it's very suffering. You know, I don't know ever experienced that. It's when itchy, so itchy that it's really an agony. So we gave him a few bottles of AgX, and he sprayed. That moment after the spray, almost we call it immediately, the itch is gone. Imagine that they have been trying all the drugs, they couldn't solve it. But AgX spray on the itchy part of his neck, the throat straight away have no more itch. And then it was for so long, he can't have no appetite. He hardly take anything. So we asked him to drink it, and then now he can take it very, very fast. Just a short few 2 days later, he has appetite to eat. You know, but I still have confidence that I can help this brother, this guy. Yeah, but AgX is a very, very helpful product. You know that a lot of antibiotics pills have a limit, but nano silver has a very wide scope of usage. Yeah. Then here, there's a diaper rash, infant or seniors. Yeah, I think many infants are crying loud, not because they are hungry or they are whatsoever. Most of the time they have diaper rash. The buttocks are too itchy. They just hope that the mommy can go and help them scratch something, you know. But most of the time, mommy just oil, you know, just pat the back, and the baby still crying. So diaper rash is very serious, and it's also not just for baby. Now, if you have babies, you can spray to the genital part, and then before you wrap with diaper. Or old people, senior citizen, you also spray on the diaper, and then you let the senior to wear. It's less itchy, and even if they happen to urinate or poo, the smell is not so smelly. It helps a lot. So these are what I've shared with you is the what do you call it? The benefits now. These are benefits of silver. So here, there's a lot. I won't be going all this to you one by one, because the time. Let's see how much time I have. I've taken 20 minutes already, so we can take 5 more minutes to go through very fast on what you can see the extensiveness of AgX, and then after that I will pass back to Andrew for the Q&A time. You see, it's stop bleeding for most wounds. In my car, I always have a few bottles in case of any accident. I use the AgX to spray on the person's wound. That day I was in Puchong. Now I am in Sandakan. I was once in Puchong. There was a bad accident. One guy have a very severe bleeding on the hand. So he don't even know I'm a doctor or not. So I asked him, give me a hand. I use the AgX to spray on the wounds. Immediately, just a few seconds, not having to a minute yet, the bleeding stops. And after that, when the bleeding stops, it took him to the doctor, emergency, everything, about 2 hours, but no swelling of the wound. So the doctor also a bit surprised. How come? So it's very good for bleeding, for wounds, and fast relief for toothaches, instant removal of bad breath, safe for pregnant and nursing mother, especially those childbirth wounds. If you go for cesarean, it's quite painful. You just spray to the cesarean part, and you see the recovery is very fast. So it is the mother in delivery and recovery process. A small dose will improve the digestive process without upsetting the stomach. One of the most common problem with food today is salmonella. Recently in Singapore, they recall a lot of eggs from I don't know which farm, chicken farm. The eggs contain salmonella. It is a food. It can cause food poisoning. So recall back. But salmonella, if it touches on any of the ECS, our AgX, it will naturally die. We're going to take it. And then E. coli. E. coli is a very common food poisoning. It affects our urinary tract infection. It causes diarrhea. There's a lot of internal wounds inside. So if they take the food that causes E. coli, they can suffer stomach pain and diarrhea. So that is why when they buy drinking water, the drinking water must be tested, and it must be free from E. coli or coliform. Now these are the two bacteria that is inside the water. But if you put in a spray, just a spray of ECS before you drink, it is definitely very safe. The presence of E. coli will die immediately. Immediately, it's very fast. Here says that it only 2.5 ppm, it will solve it. Our content is 20 ppm. So streptococcus is a very, if you look at streptococcus, you have so many names for it. So you know there's a sweet called strepsil. Strepsil comes from this streptococcus germs, bacteria. The strepsil will use to kill this. So if you have streptococcus, you have throat infection. It will cause you fever. So when you take the strepsil, it helps a bit. But if you spray nano fever, I guarantee you, it will help you very fast. I used to speak a lot in the church. At one time, I have totally no more voice. That was early morning, 8 p.m. I'm supposed to deliver a speech, a sermon. But at night, I have no more voice, completely zero. I can't even talk. Then I use AgX to spray. Every hour I spray one time. Every hour I spray onto my throat. By the 5th hour, I can talk again. In 5 hours, whatever virus germs, it allows the throat, the cell to grow back. If you do not have AgX, the infection is getting worse and worse, hardly recover. So it will take days to recover. It still recover, but it will take days. But AgX is so fast that within hours, you can talk it back from no more voice into a voice. So it's very effective for streptococcus germs. Yeah. Then here you see you can have open cut wounds, diabetic wounds, itchy skin, diaper rash, spray in the shoe, athlete's foot, underarm deodorant, better than those peppermint spray or deodorant spray to the armpit. Minor burns to speed up healing for our face acne. If you have toothache, after birth wounds, sanitary pad. So for ladies who have menstrual period, I advise you, you can use this AgX to spray on the pad before you use the sanitary pad. First of all, there's less germ infection and no smell. It's very interesting. And then for ladies, you can it's good for toilet seats. So you spray on the toilet seats before you use it. So areas with foul smell. So then air conditioning. Some of the air condition, the smell is quite foul. You just spray into the air condition, and then you on it again. You get fresh air. Very amazing. Foul smell including dustbin. Even the bee. Recently, my worker was stung by a bee, a wasp, and it's very painful. You just spray to the area. In 2 minutes, he forget he was stung. He just continue to work. It's no more pain. Yeah, and then you can sterilize it with for utensil. You can sterilize it. So there are many uses of this AgX when in your hand. So when you're holding an AgX, it's very convenient and handy. Sinus infection, conjunctivitis, toothache, mouth ulcer, sore throat, infected scalps, including dandruff, some of it. Then talk about infection. If you have lung infection, like today's pandemic, you really need to try inhale through your nose to your tongue to your lung. Your throat infection, sinus infection, running nose, toothache, conjunctivitis, toothache, stomach ulcer, colon ulcer. Also, 1 year back, I have one friend who have an operation on colon operation. After removing of the colon, part of the colon, that wound inside. So he used to drink AgX, the silver solution. The recovery is so fast, it's amazed the doctor. Normally, it would take a long time. But those after operation, internally, when they administer it orally, the recovery is far faster. Diarrhea, urinary tract infection. For diarrhea, one of my son went to Jakarta. Because of flash flood, somehow he got diarrhea. And then he called us through WhatsApp and asked us what to do. But fortunately, he brought 2 bottles of nano silver solution with him. So I asked him, you just drink 1/3 or half bottle in it. Just drink it. So he obediently listened, he drank it, and a short while, no more diarrhea. It's amazing. You try that. If you ever happen to have any stomachache or diarrhea, you try to drink AgX. Yeah. So that is my presentation on now for this AgX discovery, the extensive usefulness of nano silver AgX. So when I advise you to carry around. So where where is the suitable places to keep this AgX silver? Ladies' handbag, in your briefcase. If you are confident, you keep one in your living room, your kitchen, your bedroom, everywhere you will keep it. So 6 bottles is very little. You keep everywhere. Bathroom, toilet, shoe racks, in the office, in the meeting place, like my factory. Though we have only a few tens of workers, but very often they got cut the fingers or whatsoever. This is so handy. They just spray. The workers will automatically go and look for it. They spray on their hand and it's okay. And then in your private car, when your car aircon is not good, as I say, spray on the aircon. You will be surprised the air become very fresh. Taxi, buses, more on the old folks home, senior care home, children nursery, dental clinics. Why dental clinics? You can try when you pull out your teeth. In case you pull your teeth, You spray onto your mouth to teeth there. You can see how fast is the recovery. The bleeding stops immediately, and then it allows the cell to recover. So when traveling, please take a bottle of ECS, AgX with you. This is very handy for you. Yeah. So do anyone has a testimony to share? We have 2 minutes. One person share a testimony of your use of AgX? You can have 2 bottles. I can give you 2 bottles. Okay, you can unmute your speaker and then you can share.
No, because all the mic is locked. Locked, so they cannot unmute themselves. So if anyone want to have a to share his testimony, you just raise up your hand. I will unmute you. Yeah. Anyone have want to share their testimony?
How many of you have used this AgX extensively before? And any testimony you have, you can share to us.
Now, if there is no one, why don't I share mine?
Okay.
I have now my daughter 3 years old. Last year, when she's about 2 years old plus, she got a bite by some insects. I don't know what is it. But the wounds, I mean, the reddishness is actually getting bigger and bigger on the leg itself. So at the initial stage, never think of AgX first thing. Instead of using the traditional way of using oil to apply on it, but after applying for it for a while, the reddishness actually does not disappear. Instead, it's getting worse and worse. So after thinking for a while, there is no choice. Then I thought of the AgX. So I decided to give my daughter a try. So what happened is that I spray on the wound itself. After just about half an hour, all the reddishness, initially it's getting worse. It's all starting to subside very fast. So that is the first time I experienced on the goodness of this AgX. I think there's someone who also want to share. Linda, go. Linda, I unmute you. Maybe you share your testimony.
Yeah.
Linda,
hi.
yes.
Yes.
Yeah.
Hi. Good evening. Good
evening.
evening. Yeah. I just want to share that. At one time I was having insect bite on my hand, and it swelled up very much. And then I immediately used AgX to spray on it, and it subsided. Say it's about half an hour, it went down. Okay. And the second incident was I like to make curry puff, so I fried them, and immediately it is the cook that tastes first. Okay. So I took one, and my toothache was, the gum swell. So I used AgX also. It works very fast. Yeah, that's my testimonial for today.
Thank you, Linda.
Yeah.
Okay, you got 2
It's
bottles.
very useful.
Yes.
Thank you very much. Really. Right.
Okay, Linda, thank you. So, okay, so there is the testimony from Linda, and of course, AgX is really very useful. But now, of course, we are open for Q&A. If there's any question that you would like to ask, you can always type in or raise your hand. Yes, Celeste, you have any question?
Yeah, Andrew, my downline GP would like to share her testimonial. Can you unmute her because she cannot find one? Yeah, GP.
Who is that?
GP. On the screen. Yeah, GPO. She would like to share.
Okay, got it.
Thank you, Andrew.
Got it.
Thank you.
Oh, I cannot unmute her because I don't know her file is actually private. Let me try again.
Hello.
Who is that? Who is that? Is that GP?
Yes.
Yeah, GP.
Yes. Yeah,
Hi,
yeah.
everyone.
Correct. Yeah. Okay.
Hi. I'm actually quite new in this product. Actually, I have so many bottles, but I, sometimes forget to use. Okay. Now, after going through this, I think it's going to be very useful for me. But I like to share one of my downline, my customer. He had this fungus infection problem for 40 years. 40 years, and he has been taking steroid cream. He's been using steroid cream all this while until we introduced him the AgX. And after a few spray only, he was so excited. He called me and said that, why didn't you introduce me this one earlier? I had suffered for 40 years, so he was so happy. So he's currently using, I think, a few bottle of AgX already. So, it has helped him a lot with the fungus infection. And also sore throat. He uses it a lot for sore throat also.
Good.
That's my sharing.
Okay, so you still get two bottles complimentary.
Oh, thank you.
Yes.
Okay. For this GP, can you leave down your full name and your phone number? Otherwise, I don't know who is it. It's just GP. That's all. Okay. Thank you so much. Now, we are open for Q&A now. Any expiry date for AgX?
Okay, first thing, silver have no expiry. That's why we don't put the expiry date. You can keep for 5 years, but not under the hot sun. And you don't need to freeze it. No need to go under the refrigerator. Just under normal room temperature. It will last you for 10 years. After that, it's still usable. Okay, so no expiry date yet.
Okay. James, the next person want to ask some questions. James, go ahead.
Yeah. Hi. Good evening. Yeah, I got a question because I also introduced this AgX to most of my customers. Then I teach them how to use a spray on the hand, and then when you have a mouth ulcer and then you have a gum infection or whatever, or your sore throat, you can spray. Then after 1 or 2 days, immediately he called me up. He said, "Hey, James, I think you give me a wrong instruction, the direction." They say, according to the bottles, it's only for external use. How can you ask me to spray on the mouth and all this? Is it poisonous? So why our bottles outside say is for external use, whereas our we are teach to use for the mouth and drink this.
Okay.
Sorry.
Yeah. Good question.
Yeah.
Good question. Okay. The one of the reason is that we are still trying to approach the Ministry of Health. They just get so confused. When they check all the data, they do not know where to put us into, whether it's under facial or what do you call it, skincare product or under medical. So they allow us to sell, but they haven't given us a license number officially to put in. So if we claim oral, so we have to go through medical, and then the test will be for 10 years. If there's a standard they need for medical tests, that is why they couldn't give that green light to put in there. You can drink, but so for topical use on the skin external, they are okay. But if you want to drink, they're not. We don't put in as a label in there until we got a license. But so many of them have used it for the sore eyes, their running nose, their sore throat, their what do you call it, stomach ulcer, then stomach ache. It's okay. So it's non-poisonous, non-toxic. So the label on the top is only for topical use, not for oral.
Yes. Let me just elaborate further. Now, by right, that's why the ministry couldn't categorize which this product is under. So in order for us to be able to sell, that is why we have registered, categorize it under the disinfectants. Now, in actual fact, under the disinfectants, it is required by the ministry that you must put a warning sign on the bottles that you cannot consume it. Okay, but in actual fact, for this AgX, you can actually do that. Okay, that is for your knowledge why we are putting all those do not consume it orally, that type of warning that is required by the ministry. But in actual fact, this product shouldn't be categorized under disinfectants. In order for us to be able to sell quickly, because the ministry also couldn't categorize which one does it belong to. Okay, that is why we actually to register it under the disinfectant so that we can sell it quickly. Yeah, that is the reason. Is not because it is poison or it is harmful to our body and all those things. James, you can be rest assured on that. Yeah.
May I answer the question of Sally?
Yes, we will go one by one. I think we will go one by one so that you all can, at least other people can benefit as well.
Yeah, okay, Grace here.
Okay.
Grace here says, please elaborate how to use as eye drop. We don't use it as eye drop, we just spray to the eye. Many lorry drivers, sometimes when they're driving the car, their eyes are very tired. When they spray to the eyes, they didn't say that it's refresh them very much. But for those who are infected with conjunctivitis, you just spray to your eyes every 2 hours. It's not invasive at all. Then you can see that the eyes improving very fast. Hope this answer the question.
Okay, the other question is from Na. For acne on the face, how many times a day?
3 times a day. You get just in the morning, afternoon, evening, enough. Every between 8 hours gap. 6 to 8 hours it is effective there.
Okay, for throat cancer after therapy, how much to add in water to drink? That is from GP.
You don't drink the water, you spray to your throat. That would be better, more concentrated, spray to the throat. Every 2 hours, you spray 1 time, 2 hours, 1 time. The throat, that I just show you the picture just now on one guy. He have a throat cancer. It's very irritating and very difficult to talk. After spraying it every 2 hours, you can talk back. It helps. The voice coming out a little bit, even though the talking can be difficult, but at least they can talk.
Does it help with periodontal disease?
Periodontal disease is a gum disease. It's very good. You just spray AgX to the gum. Okay, 3-4 times a day, not say too long, but because as I told you, between 8 hours gap, 6 to 8 hours, so 3-4 times it will be good enough. Just spray to the mouth. Don't gargle it with water. Make it concentrated, spray to the mouth, and you see the gum is not painful. The disease will subside gradually.
Can you use it for dry eye syndrome?
Yes. One of the pastor that I know, he have a dry eye, but it is improving. But it won't have one shot because it's the internal organ problem. Actually, eye problem, this dry eye syndrome, in Chinese medicine is the liver problem. Of course, you consult the Chinese medical team, or you can consult a specialist. But it does helps a lot. But if you want it to be fully cured, you go and get a specialist. But I advise you try Chinese medical thing on your liver. Liver attached indirectly to our eyes.
Yes. Can AgX help brain cancer?
No. This you can't. It helps you when you drink it. It helps a bit, but it can't go to your brain. So brain cancer, you try to take some alkali food that's my advice It helps a lot.
Has it been tested on COVID-19 virus?
If it is official, no. But unofficial, a lot. Recently, even my own second brother, he was already 76 years old, so he was contracted with COVID-19. So he can't breathe well. He was in Sungai Buloh, I was in Sandakan. So what can we do? I asked Titus, to send him AgX immediately to Sungai Buloh Hospital. And then he was on oxygen. And then we spray to his nose, in the same day, he can breathe normally, on the same day. So I cannot officially or medically say it's tested for COVID-19 virus, but it's very helpful to spray against, it does protect the lung.
Sally is asking, does it help with lung cancer?
Yes, you need to inhale. Okay, you need to inhale. I have a few. Well, I have been dealing with cancer patients for 20 years. Okay, happen to be so I'm not an expert or doctor or oncologist, but during the 20 years in this association with a terminally ill cancer patient, over the 20 years, I have so many such patients. Lung cancer, they need to spray to the nose, okay, inhale it and let the lung at least recover. But of course, to recover from lung cancer, there are other processes, and iron laser is a very important part of it. Last time it takes me 6 months to help cure one guy. Now, lung cancer, 2 months. So that's why I call it complementary therapy. You know, it's amazing. So why I'm so interested in iron laser, because this really helps together with AgX. It is really become a very powerful tool. It does help. You can, if you are interested, Sally, you can WhatsApp me later on this how to deal with cancer things. Yeah.
Okay, any more questions? Yeah, why don't Sally, you leave a contact, down with Albert, so that at least he will write your contact. Okay, Anthony. Okay, Anthony. Yes, Anthony.
Yeah. Thanks, Andrew. Just want to find out, how do you treat this colon cancer or ulcers or stomach ulcers? How do you take it?
Okay, why don't I put it in this way lah? Okay, for this cancer, for any cancer.
No, this ulcers, ulcers.
Ulcers or ulcer. Yeah,
Colon and
ulcer.
stomach ulcers.
Yes. Albert, ulcer,
All right.
how to?
The best is to drink it. Okay, one bottle of AgX is 60 ml. Okay, normally you take about 6 bottles. It should be all right already. That means 10 ml per cup. A cup of 100 ml water. You add in 10 ml in the morning, then 10 ml in the afternoon, 10 ml in the evening. That means one day you just have a bottle. 2 days will be 1 bottle. Around 6 bottles, that is 1.5 months. 6 weeks, your ulcer normally is all subside down. No more ulcer. That is from experience. They have to drink it.
Yeah. Okay, Anthony, is that okay?
Thank you. Noted.
Yeah. Okay. Okay, any more questions? If no, then we will finish off the sharing here. Okay, thank you so much, Albert.